Hey everyone, I'm Jacob Durant with JDL Access, and I've got Danielle Bargle with me here today. We're excited to have you all with us. If you're not familiar with JDL Access, we help medical technology companies navigate reimbursement challenges. Basically, we make sure patients can actually access treatments they need by helping companies with patient support programs and working with payers to improve policy coverage. Now, if you've been keeping an eye on Medicare's LCDs or local coverage determinations for skin substitutes, you know some big changes are coming. Quick side note, while Medicare calls these skin substitutes, the more technical term is cellular or tissue-based products for wounds. But to keep things simple, we'll stick with skin substitutes for today and for the rest of the series. These challenges could have a huge impact, not just on companies, but on millions of patients. So, we want to take a step back, break it all down, what's happening with Medicare, how commercial insurers are responding, and what it all means for patient access. That's exactly why I've got Danielle here with me. She has a lot of experience in wound care patient access, and she's the perfect person to help us understand what's going on. Danielle, do you want to introduce yourself?
Yeah, thank you, Jacob. Hi, everyone. I am Danielle Bargle, and I am the senior manager here at JDL Access. I'm really excited to be here. I have been working in wound care specifically with patient access for a very long time. Let me tell you, a lot's happening right now that could really shake things up.
Yeah, and that's exactly why we're here. So, to kick things off, let's talk about where we stand with the Medicare LCDs and how we got here. Danielle, can you give us a quick overview?
Yeah, of course. So right now there are three active LCDs for skin substitutes. These policies come from three Medicare administrative contractors, also known as MACs. They are First Coast, Novitas, and CGS. The other four MACs no longer have active policies, but instead determine coverage case by case. Under the current LCDs, patients can get up to 10 applications over a 12-week period.
Okay, so 10 applications in 12 weeks,
Mhm.
and that's where we are right now.
Exactly, yes. But back in early 2023, Medicare proposed some big changes. Instead of 10 applications, patients would only have access to four over that same 12-week period,
Wow, okay, that seems like a pretty drastic cut.
right? Exactly. And from the clinical standpoint, a lot of experts felt that four applications just isn't enough to properly heal a wound. That's why there's so much pushback. Clinicians, patients, wound care consultants all voiced concerns, and as a result, Medicare decided to postpone the change.
Okay, so they postponed the changes, and now here we are 2 years later, still in limbo.
Exactly. That change was originally supposed to roll out in February, but now we've been pushed to mid-April. And honestly, at this point, we're all just waiting to see if it actually happens.
So let's talk about why these changes were even proposed in the first place. Do we have a clear answer on what prompted Medicare to consider cutting the number of applications so drastically?
I know. Honestly, no, there's no official crystal clear explanation, but based on what we've seen, it seems like Medicare could have been concerned about overuse or maybe even a perception into much product was being wasted, which could mean higher costs for Medicare.
Okay, I've got it. So, from Medicare's perspective, they might be thinking something along the line of we're paying for too many applications and some of it just isn't needed and isn't necessary.
Right, exactly. But here's the problem. The assumption doesn't necessarily line up with the clinical reality. For some patients, 10 applications might be exactly what's needed to heal a wound properly. Cutting it to four could mean patients aren't getting enough treatment, which could lead to worse outcomes and possibly even higher long-term costs. This is why everyone is concerned about it right now.
That makes a lot of sense. Okay, so we've covered where we are now, how we got here, and why these changes were proposed in the first place. Next week, we're going to talk about what all this means for Medicare submissions, especially with these potential changes looming. And for everyone out there, if you're in the industry and you're wondering how to navigate this, please make sure to tune in. Danielle, anything else you want to add before we wrap up?
Just that things are still very much in flux. So if you're working in this space, stay informed, keep an eye on the updates, be ready to adjust your approach, and if and when these changes do actually take effect.
Great advice. All right. So, everyone out there, if you have questions, if you want to learn more, please feel free, reach out. At very least, make sure that you tune in, watch next week. We're going to be making sure that we keep updates coming out. And that's it for today. Thanks for joining us, and we'll see everyone next week.